this board monthly meeting for Wednesday, September 10th at 5 p.m. to order. Can we call the roll, please?
Danielle Chenoweth.
Present.
Jennifer Locke. Present. Kyle Patterson.
I would entertain a motion to approve the agenda. So moved. Second, any discussion?
Nope.
All those in favor? Say aye. Opposed? The ayes have it. Next, we have approval of the minutes of previous meetings. Any changes or discussion to August 13th?
Nope, so moved.
We have a motion, I'll second that. Any discussion? All those in favor say aye.
Aye.
Opposed? That carries. Next, we have public participation. Is there anyone here as a member of the public who would like to speak to the Board of Health? Once. And twice. Okay. Our administrator is out. Is there any correspondence from board members? No? Old business, we have none. New business, we will move to the treasurer's report on.
And as of July 2022, we're showing cash on hand of $9,269,527. Our total fund balance was $8,275,715. That represents 45% of our budgeted expenditures for the years. For the first fiscal month, we had a deficit of $215,421, and that was against the budgeted deficit of $98,306. Our total annual budget is $18,293,868. For the first month, we had total revenues just in excess of $1.1 million, which is about $266,000 under the year-to-date budget, mostly due to our contracts and grants being under contract under the year-to-date budget by just $250,000. Expenditures for the first fiscal month, we had $1.3 million, which was $149,000 under what we had budgeted for the fiscal year-to-date, mostly due to personnel being $61,000 under budget, and then fringe benefits being $32,000 under budget, patient care $32,000, $23,000 under budget, and $19,000 under budget with the supplies for the year-to-date.
Okay. And year-to-date is July 1. Is that correct?
Yeah.
Okay. Is there a reason why the budgeted expenditures are at 48%? Is there concern around that, even though we are into the first quarter?
For the end of the first month for the quarter.
At the end of the first month of the quarter, we're at 48%.
45% of the budgeted expenditures for the year. And that's within our guidelines of 25 to 50% of the annual budget.
Got it.
So it's on the high end
Yeah.
as far as the cash balance.
Okay. Any other question? Okay. I entertain a motion to put the treasurer's report on file.
So moved.
Second, any discussion? All those in favor say aye.
Aye.
Aye. Opposed? That carries. Thank you, Ron. Next, we'll take approval of payments to Board of Trustees appointees in omnibus fashion for Treasurer Ron Fields for the August 2025 services, and for Administrator Julie Pride for mileage reimbursement for the Rantoul Health Fair and the Spring IAPHA meeting. I'd entertain a motion.
So moved.
Motion and second it. Any discussion? All those in favor say aye.
Aye.
Aye. Opposed? That carries. Next, we have a review of the credit card statements. Any questions about the credit card statements? If not, I'd entertain a motion to put the credit card to approve the credit card statements.
So moved.
A motion, I'll second that. Any discussion? All those in favor say aye.
Aye.
Aye. Opposed? That carries. Next, we have approval of our public services renewal agreement. That's for September 1st of this year until August 31st of 2028. It's a 3-year contract. I would entertain a motion.
So moved.
We have a motion. I will second it. Quick question, just in terms, since it is a 3-year contract for a disposal, how are we handling renewals of existing services? Is it just that we're bidding out new services and this is simply a renewal? And was there any attempt to look at the price compared to other entities? Or is it, yeah, is my question. Was there any bidding out, or is this simply a renewal? Do folks know for the trash service?
I believe it's simply a renewal. In certain instances, there's like, for example, like elevator, company, there's only like one or two in the area. So same for like trash companies, we're very limited on the bid, so I think we just renewed it because it was very limited when we did the bidding initial.
Okay. Yeah, just say, I mean, I'm fine with going forward with this one. I just think sometimes renewals, especially 3-year renewals,
Okay.
gives us an opportunity to bring in new providers and look at cost. And so I would encourage us when we're doing renewals to, I mean, cost and our other metrics. And I know there's a number of commercial providers in the community. I know Republic is reputable, but I will just mention we may want to consider that in terms of hitting our targets. Otherwise, I don't have other questions. Okay, all those in favor, say aye. Aye. Opposed? That carries. Next, we have a lease agreement between Avicenna and CUPHD. This is for August 1st of this year. I would entertain a motion.
So moved.
Excuse me, no, September 1st. Yes, I'll second the motion. It's September 1st to August 31st of next year. Any discussion? All those in favor say aye.
Aye.
Aye. Opposed? That carries. Next, we have a lease agreement between Immigrant Services of Champaign-Urbana and CUPHD. And that is also August 1st of this year, or August 1st of this year to July 31st of next year, for a 1-year term, 599 fair square feet with $1 per square foot.
So
I would
moved.
entertain a motion.
So moved.
Second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of a Cincinnati Insurance Company property package renewal. I'd entertain a motion.
So moved.
A motion, I would second that. Any questions or discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of cyber liability insurance proposal for 25 to 26. I'd entertain a motion.
So moved.
A motion, I'll second it. I did have a question, given our situation of our fraud situation. Is this the same company that we had before, or did we change companies?
We've changed companies.
Okay, and this is cyber liability insurance?
Travelers is the carrier that we're with now.
Okay, and was there any issues given in our past record in getting this cyber
No, we have to
liability
report
insurance?
all of that when we fill out the application, and we did.
Okay.
They've asked questions about our security levels, and we've slowly been improving upon all of that. Our IT network administrator has been going to training on cybersecurity, and so is our deputy administrator. So
Okay.
we are educating ourselves the best we can.
Okay. Yeah, and I noticed that the premium isn't significantly more than it was before. It's reasonable. It went from 15,339 to a little bit over 16,000. For you fraudsters who are watching on television. Any other discussion?
Yeah, I just want to make sure that it's the same general terms as the last one. And the reason I ask is that pages 70 to 75 in our packet are just
You're kind of
garbled.
scrambled. Yeah.
But I
Oh.
can make out that it says the same as expiring. So as long as it's,
It is the same as
Okay.
expiring, yes.
okay. Yeah, it was nice. Maybe it was
I'm
just
sorry
the way
about
I
that. I don't
That's
know.
okay.
Yeah,
It's
it's
a
just-
weird. It's a weird garble.
It's just because it's the cybersecurity one.
Yeah, it's kind of weird, isn't it?
No. Right.
I'll get you a different copy so you can look at that.
Yeah, if you could just email that to us, that'd be awesome.
Yeah.
Thank you. But, as long as it's the same
Yeah.
terms.
Yeah.
There's a
And
summary.
a different company, yeah.
Yeah, there was a summary after it, but
Yeah.
that like actual terms is a weirdo kind of situation.
But otherwise, full support.
Okay, yeah, no, we need this. Okay, all those in favor, say aye.
Aye.
Opposed, that carries. Preliminary discussion regarding IMRF early retirement incentive program.
Julie asked me just to mention that we are putting together a proposal to look at IMRF early retirement. We're putting together cost analysis and things like that. We want to put it on the agenda for next month's meeting, so just to give you a heads up that that will be on the agenda.
It is I know a good amount about IMRF, but is it, and I know we'll talk next week or next month, but is it that, we would be incentivizing out of our funds for people to take early retirement through IMRF? Because I don't think I mean, I guess you're allowed to take the funds out, but they don't, I'm not aware of them having an early retirement.
Oh, yeah, they've had that. We did it before in 2007, and it wasn't until recently, about a year or so ago, that we realized that we could do it again. And I think we were told at the time that you do it once, you can't do it anymore. But the truth is, you do it until it's paid, you know, you do one, it has to be paid off, and then you can offer another, so.
Oh, interesting,
Yeah.
okay.
So-
Well, I look forward to learning more then. So, cool, so we will look forward to that next month. Next, we have approval of happy or not patient feedback software proposal and agreement. I would entertain a motion.
So moved.
Second,
Just a note on this, I reviewed the contract, or was asked to review the contract on this. I don't see any problems with it. It is a 60-day, after the first year, I think, or if there's 60 days notice one has to give with regard to like wanting to terminate. So not that this is something you guys would want to terminate, but just to keep in mind the sort of notice requirements or counseling that 60 days.
60 days before the end of the contract, or it ends up, okay.
Or it renews.
Okay.
But I don't see other problems, and I know other contracts sometimes have the 60 days or something similar for a non-renewal.
Any discussion? All those in favor say aye.
Aye.
Opposed? That carries. Next, we have a field site affiliation agreement with Walden University. I'd entertain a motion.
So moved.
A motion, I would second that. Any discussion? Is this a social work field instruction?
I think it's MPH.
Okay.
It's a online-based university that provide Master of Public Health, and they just want some of the public health department to be included as part of their field site.
Okay, but it would be on-site field work?
Yes.
Okay. And it's accredited at the university?
Yes, online accredited.
Okay. Great, I don't have any further questions. All those in favor say aye.
Aye.
Aye. Opposed, that carries. Next, we have ratification of payment to Mamadou Tankara, Deputy Administrator for reimbursement of travel and moving expenses from Utah.
So moved.
So motion and second, I believe it is retroactive because I had approved it to be in line with this contract. To have motion and second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Thank you for moving from Utah, we appreciate you. Next, we have approval of check request payable to McCormick for HVAC upgrades. I'm gonna take these in omnibus motion. It's fiscal year 26-006 RTU 503, fiscal year 26-006 RTU 504, and fiscal year 26-006 RTU 514.
So moved.
I second. Any discussion? All those in favor say aye. Aye. Opposed? That carries. Next, we have approval of check request payable to Stocks Office Furniture for fiscal year 25-021 MCH conference room table and chairs. I'd entertain motion.
So moved.
The motion is there. I will second it. Was this, since it's a kind of large bid, well, no, it's under $10,000. What's that?
9,714.
Yeah, 9,714. We didn't do a comparison at all because it's under 10,000. Was there a reason why we didn't?
There was a comparison.
There was a comparison.
This was done a while ago. I have to have a refresher on what your numbers and everything like that. But there was a bidding process for this.
Oh, okay. There just wasn't the sheet at the top
Mhm.
that says what the bidding process was, usually there's a sheet that explains kind of like what the point system that people received, it just wasn't in the packet.
Okay, I'll let you know.
What's that?
I think that was approved before and then this is actually.
Oh, okay, oh, it was approved and then, I
Yes, this
really
is
get
what
messed
I'll-
up with the approval versus the payment.
Yes.
This says approval of check request, got it,
Yes.
rather than the contract. Okay, thank you for that. Any
Is
other
that it?
discussion? We have a motion, I'm seconding, all those in favor say aye.
Aye.
Opposed, that carries. Next, we have pending grants contracts for administrators to sign. No? Okay, this is not for this meeting. And then we have our next monthly meeting is October 8th, 2025 at 5 p.m. With no further business, we are adjourned. Thank you. I still got all my questions to do. Definitely good at asking all the questions.
Is that my band stuff?
And making sure that
Ain't
the.
that-
Molly Law?